with your thyroid can be an indicator of an array of problems. Dr. Justin Malek is an endocrine and thyroid surgeon with Grandview, and he joins us this morning to talk about this. Good morning to you.
Good morning.
And so when you, as a surgeon, people might talk about having thyroid issues, but what's the difference in just maybe having a thyroid that's, you have something wrong, you may be gaining some weight, and when you would need surgery?
Sure. So most commonly I'd say patients have issues with making too much or too little thyroid hormone. Often surgery is reserved for those patients when they're making too much thyroid hormone.
Okay, so what's happening to the body at that time?
Usually you would have symptoms that are indicative that you're having an increase in your metabolism. So diarrhea, feeling hot, maybe chest palpitations.
So unusually hot, not normal.
Correct, yeah.
Right.
And weight loss that's unexplained.
And does it sometimes go undiagnosed for a while before you would see someone for that?
Certainly can. It certainly can. And
so if you are having any of those symptoms, you would talk to your primary care doctor first, or walk us through what you would do?
Sure. So that's typically in the case of hyperthyroidism, where you're making too much thyroid hormone, you would see your primary care physician or an endocrinologist that usually draws some basic thyroid function labs, and that would tell us how your thyroid is functioning.
What is the basic function of the thyroid?
So it's that, to control the metabolism in basic terms.
So that's really what it is?
So it has a big, it creates the thyroid hormone that then hits several receptors throughout your body to help regulate your metabolism.
So when someone says, I have a fast metabolism, I have a slow metabolism, they may not have a problem, but that is dictated by the thyroid?
Could be very, very closely related to the thyroid, yep. And
so what would you recommend if someone, it feels like they have, oftentimes they wanted to have theirs checked? How do you get it checked? What is done?
So the most common and least invasive way is to get those labs drawn, and then to also get an ultrasound of the thyroid gland as well, which can look for nodules that can sometimes be overproducing thyroid hormone, or could also be a risk for cancer as well.
I'll say, and so some people who do have thyroid cancer, it's a relatively treatable form of cancer?
Yeah. So thyroid cancer is very treatable, especially when it's picked up early. And the cure rate is very high, usually in the 90th percentile.
So I guess like with anything, don't ignore symptoms and don't feel bad about asking your doctor.
Correct. Yeah, especially if you have symptoms, you notice a new lump in your neck, or changes in swallowing, breathing, changes in voice, those would all be symptoms to look out for.
All right, very good. We have to look out for those things, and if you feel like you need to have those checked, certainly talk to your primary care doctor. Dr. Malek, good to see you.
Yep, thanks for having me.
All right, thank you for coming in. All right, where are we going, Kelly? I'm sorry. All right, let's go, Jay.
All right, what's your favorite food? The pilaffi.